evil bacteria tuberculosis bug.
I'm the evil tuberculosis bug.
After a patient with tuberculosis coughs up the bug spreads through the air. If another person breathes in the tuberculosis bug, the bug will grow in the lungs. Tuberculosis has 4 major symptoms. Weeks of continuous cough, coughing up blood, fever, weight loss. Beware. If you have had close contacts with a friend or family member who has tuberculosis, you must be careful if you have developed the symptoms. If you develop symptoms described above, you should go to the hospital for additional tests. 3 ways to diagnose tuberculosis. Tuberculosis skin test, sputum stain and culture, chest x-ray. 4 medications to treat tuberculosis: ethambutol, isoniazid, pyrazinamide, rifampicin. How do you treat tuberculosis? Take 4 drugs for 2 months, then 2 drugs for another 4 to 7 months. If you develop the following side effects, please contact your nurse or doctor: ringing in your ears, hard of hearing, dizziness, headache, blurry vision, urine becomes darker, tea-colored or brown, jaundice, yellowing of the skin or eyes, joint pain, muscle pain, fever over 3 days, pins and needles sensation. Must I take so many medications? Taking multiple medications will ensure that the bug is killed. Why do I need to take the medications for so long? Tuberculosis bugs are difficult to kill. Taking the medications for a long time helps ensure that all tuberculosis bugs are killed. Why do people monitor me taking drugs? There are many different kinds of drugs that need to be taken regularly, so it's easy to get mixed up. Not taking the medications as necessary may lead to resistant bugs. We will be watching you. My cough stopped after I started medications. I can stop taking the medications. This just means that there are less tuberculosis bugs, but may not mean that we have cured the tuberculosis. It is very important that you continue taking the medications as prescribed. I've been immunized against tuberculosis, so I can't develop tuberculosis. You may still develop tuberculosis after being immunized against it. If you develop symptoms of tuberculosis, you still need additional investigations. Only symptomatic patients with tuberculosis need to take medications. Patients with tuberculosis may not always be symptomatic, and they still need to take medications. Those who come in contact with tuberculosis may also need preventive therapies.